What if there was a place where kids could go for quality health care right in the comfort of their own school? Sound too good to be true? School-based health centers provide easily accessible and high-quality health care. They make sure students who do not receive medical treatment anywhere else get it at their school. 7 of these types of school-based health centers exist in Allentown School District and are funded by Sacred Heart Hospital.
I think that all schools should have a clinic because it's very convenient. My child learns better, she's healthier. She doesn't spread anything around because the clinic is within the school. I find it very friendly. They know what they're doing. It's convenient. I know how they work. I think it's important for the children's education.
I live like 2 blocks away, so it's very comfortable for me, and it's easy for me to get here. My husband works and I stay home, and I know there's a lot of moms like me, and while their husband's not working, we don't have transportation. So I know that there's a lot of parents that come here, because it's nearby.
Their main purpose is to provide students with easily accessible health care when they are ill. The easy access of these health centers are very important. Health services must be where students can trip over them. As an early school health center pioneer described the importance of easy access. Any system that requires complicated transportation to unfamiliar providers in unfriendly settings will fail.
I came once I had a sore throat, and my nurse, she told me that I had strep throat and I had fever, and she gave me a prescription, and she called my doctor.
A school-based health center is trying to bring medicine, prevention, and caring for sick children in the schools. I think the school is very safe. It's a very safe environment for the kids.
You don't need to worry about scheduling an appointment anywhere else. Child can come to school on time, and their appointment could be sometime during the day, and you would be notified, when the appointment is, and then your child would be seen. If there's medication that needs to be prescribed, you would receive the prescription for medication just like any other doctor's office. If they happen to have medication here, your child would receive the medication from the nurse practitioner.
And if she has a physical, they pull her out. If immunization, they pull her out so she don't have to be absent. So it's great. And if she needs to get seen by the doctor, I just bring her here. I mean, anytime I can come here. It doesn't matter, So she's always been, she gets seen here. The good thing about it in that clinic too, you have Grace that she speaks Spanish. There's a lot of people here that don't speak English, and she can help them, whatever information, they need, she helps them too. And not only that, but they work wonderful with the kids. They are very good with children.
School-based health centers specialize in fast on-site care, but they also focus on providing the highest quality care possible. 71% of students reported having a healthcare visit, as compared to 59% of students who did not have access to a school-based health center. School-based health centers show significant increases in healthcare access by students, according to studies conducted by Mathematical Policy Research.
Well, I know a couple of times my daughter had strep throat, and when I brought her in, they were very gentle and they knew exactly what she had. All they had to do was just go to after I left work, just go to the drugstore and get the medication they prescribed for her.
They have a lot of things here, like they have therapists here. They have other doctors besides therapists, and besides physical, they have other things here, and I've used them, and they've been very helpful.
So the services are acute care, chronic care, specialist care. If we pick up sometimes there's a child who comes to the school base that might need a cardiologist or a specialist, and we are able to provide those kind of services by referring. And probably one of the very important ones is prevention. A lot of children don't have the shots they need, don't have those physical exams that they need, their vision and their hearing and their hemoglobin tests. And by doing it in the schools, right there where they are, it just makes it a smoother transition.
The range and quality of services offered at these school-based health centers is exceptional. They are helping to keep students as healthy as possible. By keeping students healthier, their attendance and academic performance have dramatically improved. Decreased absenteeism and tardiness was widely reported amongst adolescents who received counseling services in a school-based health center, according to the National Assembly on School-Based Health Care.
I believe school-based health clinics are important because it makes a connection between the academics and the attendance, and so every student is getting everything they need in one location. I've seen in my experience that some students definitely, after using the clinic, they are much better academically. They are coming to school, and so they're learning better, and they want to be here.
We can educate. It's important to be able to be in the school because you can also teach them a little bit about their illness. And while I'm speaking of education, it's a passion of mine that healthy children are children that will learn better. So if you can keep somebody healthy, chances are they're going to have a much better educational experience.
These school-based health centers provide many benefits to students by improving their level of health and helping them academically. School-based health centers are also helping the students' families and the community as a whole. The total annual cost of hospitalizations decreased by 85% for children in Cincinnati schools with school-based health centers, according to the National Assembly on School-Based Health Care.
I know that we're dealing with an urban community, and we want to make sure that we have services for families, you know, not just the students that are here, but their family. I think we need a clinic in this kind of school environment, dealing with low income, low socioeconomic status of families, and having a place for them to go to get services that aren't as easy when you don't have a car sometimes, you know, and so those things help.
School-based health centers are very important community fixtures as they provide health services for students, parents, and the community.
Her education is very important to me. And if she can get everything in the same spot, in the same place, it will be wonderful.